Hey guys, welcome to my channel, or welcome back to my channel. My name is Jenny and I'm going to continue to talk about Ozempic, and today we're going to talk about the side effects and what it might do to your body. Ozempic, the science, the risks, and the beauty standard shift nobody's talking about. Have you noticed how celebrity bodies have changed almost overnight? One year it was curves, BBLs, thick as in, and the next, hollow cheeks, sharp jawlines, and extreme thinness. This didn't happen naturally. It happened chemically. Today, we're talking about Ozempic and similar GLP-1 drugs and what the science actually says and the real risks that aren't trending on TikTok, and why this sudden shift should make all of us pause. This is not a shaming video. This is about informed consent. We need to make informed decisions, especially about our health and our body. What is Ozempic really? What is it? Ozempic is the brand name for semaglutide. I can never say it right, but it's a medication originally approved for type 2 diabetes. It works by mimicking the GLP-1 hormone, and that slows your stomach emptying, reduces your appetite, increases feelings of fullness. I lost my brush. Hang on. Lost my brush in all of these brushes. I mean, come on, Jenny. Because it decreases your appetite and it makes you feel full on just very little amount. That's why people eat less, sometimes dramatically less, and that's not good. Appetite suppression isn't neutral. It affects every system in your body, your organs. You eat for a reason, guys. The most common side effects are not talked about. They're not talked about enough. Clinical trials and post-marketing data show that the side effects are chronic nausea, vomiting, diarrhea, or severe constipation, or one or the other. That would be awful. Acid reflux and abdominal pain. In some people, these side effects don't fade. They persist for months. Could you imagine? Oh my goodness. I do have sources for all of this, and I will be linking them in the description of this video. Here's something influencers rarely mention. When you lose a lot of weight really fast, the body it doesn't just burn fat, it burns lean muscle mass. I've had to deal with muscle loss. I'm dealing with it right now, and it's really hard to build that muscle back up. But studies show that GLP-1 medications are associated with reduced muscle strength, increased fatigue, and slower metabolism over time. That's one reason why many users look frail or prematurely aged. It's crazy because you want to lose all this weight, but the side effects make you look worse. Losing weight should be done in a healthy way. And if you don't need to lose weight, you shouldn't lose weight, you know? Also have resources for what I just talked about. But Ozempic face is a medical outcome and not an insult. It is not an insult. It's obvious. It's not a joke. It's a result of the rapid facial fat loss. That buccal fat is so important, ladies. Rapid facial fat loss can cause sunken cheeks, sagging skin, deepened wrinkles, and hollow eyes. Dermatologists have even publicly acknowledged that this is a predictable biological response and not aging overnight. It's just what happens when you lose a lot of weight so quickly. You lose it first in your face, if you've ever noticed. Rapid weight loss is a known risk factor for gallstones. Clinical data shows that GLP-1 users have increased risk of gallstones, gallbladder inflammation, emergency gallbladder removal surgery. I had that. It was awful. Don't suggest it to anybody. This isn't rare. It's absolutely not rare. It happened to me at 23, and I wasn't on any kind of GLP-1. I had just lost a dramatic amount of weight. It was insane. It's just what happens after the weight is lost. And I have sources for that as well. I can back up all of these claims by the FDA. GLP-1 medications have been associated with pancreatitis. Can you imagine pancreatitis isn't the inflammation of your pancreas. The symptoms of pancreatitis are severe abdominal pain, persistent vomiting, and hospitalization. Obviously, you would need to go to the hospital if those things are happening to you. But people with a history of pancreatitis are often advised not to take these drugs. And I have resources for that as well. Ozempic carries a black box warning, the strongest warning the FDA can issue. Why? Increased risk of thyroid C-cell tumor seen in animal studies. Unknown long-term risk in humans. It's not recommended for anyone with a family history of medullary thyroid cancer and MEN2 genetic syndrome. I have sources for that. This is from the FDA. Oh, goodness gracious. Goodness gracious. Oh my gosh. So it also has mental health and emotional effects. An underrated issue. This is an underrated issue, emotional blunting. Some users report depression, anxiety, loss of pleasure, disconnection from food, and social eating. Food is not just fuel, it's culture, bonding, and joy. Suppressing that comes with psychological consequences. Experts warn that aggressive appetite suppression can mimic restrictive eating disorders, disrupt hunger and fullness cues. So, like, you don't know when you're hungry and when you're not, and when you're full. It can also reinforce smaller is safer thinking. This is especially concerning for teens, young adults, and postpartum women. What happens when you stop taking Ozempic? Most users regain weight after discontinuing Ozempic. Why? Hunger hormones rebound. Metabolism slows and muscle loss makes maintenance harder. So you're weak. Working out is harder because your body is weak because you didn't give it fuel for so long. This often creates a long-term dependency, not metabolic healing. So, like I've said, this isn't just about Ozempic. It's about beauty standards changing overnight, bodies being treated like trends, and medical tools being used cosmetically without full transparency. BBL to ultra thin to appetite suppression, and the whiplash is real. Like BBL, ultra thin, blah, blah, blah. It's awful, y'all. You are perfect just the way you are. The celebrities, let them look weird, okay? For people with type 2 diabetes or severe obesity under medical care, Ozempic can be life-changing. It is a miracle drug because it can be life-changing for those who need it. But casual influencer-driven use without full understanding, that's where the real danger lies. Your body is not a trend, and you deserve informed consent, not social pressure. Please do your research before taking any. Thank you guys so much for being here and for watching. If you made it all the way through this video, please leave a yellow heart in the comments. I really appreciate you so much, like I said. I want you to know that you are beautiful and amazing just the way you are. I hear a lot of ads on like the radio station, the radio station I listen to. They have an ad for Roe, the medical company. I think it's great to work with these companies like Roe and Hers and stuff, but I don't like that what they're choosing to promote with the brand deal, unless that they were told to maybe, but is the GLP-1 saying, like, you don't even have to go to the doctor. You can just get it on Roe.co or whatever it is. Well, that's not, you really shouldn't do that. You need to go see your doctor physically, make sure it's the right medication for you, because the muscle loss is really hard to gain back. Look at me. I'm a perfect example because I was, what in the world? I was really thin. I lost a lot of weight and I lost it real fast in 2019. I was put on a medication. You know what my doctor told me? I was 135 pounds. He said, "Oh, you're going to like this because this is going to make you lose weight," acting like I was overweight. I miss being that size. I miss thinking, "Oh, I hope I lose a couple of pounds," because it's really hard to gain it back after you have drastically lost weight so quickly. It shows, and it's not cute. It's really not. It's a man or anybody, I guess. I mean, I know it's weird when I hug someone that's really thin, feeling these bones back here, like they shouldn't feel those, you know? And a man wants to hug a woman that's curvy and soft and not bony and hard, you know? So you are perfect just the way you are. If you got some meat on you and you got a roll or two or three or four, who cares? As long as you are healthy, your blood work is healthy, you eat right, you take care of yourself, and you exercise, and you're happy, that's all that matters. Don't be pressured into taking any kind of GLP-1 because you do not need it. These medications are for people who are severely obese and they need to lose the weight fast. You guys, you are worth it, and I hope you know that, and I hope you have a wonderful day and a wonderful Christmas. Bye.